So what we're training today on is we call it POCUS for short. It's point of care ultrasound. Fairly relatively new to the field of pre-hospital EMS. They do it in the hospitals all the time. What it is we're said that great big machine for an ultrasound that they can come use in the emergency room. It is a little handheld device that connects to a tablet. So we can actually take that to the side of a patient and now out in the ambulance and actually take and use ultrasound. Today we're specifically looking for heart function. It's always looking for something to help us with those cardiac arrest patients. And there's so many uses for ultrasound in the field environment. It can be a bit of a challenge sometimes in cardiac arrest, right? It's another tool for us. So we have on that heart monitor, it's looking at cardiac function, or is ventricular fibrillation, normal sinus rhythm, all those different interpretations there. But one of the challenges can be that's electrical activity. We can't see what's going on inside the body. So what ultrasound does is it actually allows us a chance to take a look at your heart and actually see what your heart is doing. Our medical directions through UW Hospital, we got 4 docs here today. I practice a lot even in my own in the emergency room to make sure that I'm doing the right thing. So we're just starting today with, can I get a picture of the heart, right? So how do we incorporate that into a cardiac arrest and seeing whether there's mechanical heart function, whether the heart itself is actually beating in addition to that electrical function. You know, it's the latest and greatest thing. This is pretty cool. So we haven't been able to do that for us, and it's become cost effective. I will always give the shout out to this. We got this funding for EPIC, so this was an EPIC grant to purchase these. This wasn't tax dollars or a capital expense. So probably, again, something we wouldn't have gotten without that grant. So this is just really adding another tool. So the medics, I think, are really ready to embrace this, and the reasons we're going to be using this now is in a cardiac arrest. So it is helping us to guide some patient care, or can we do something else to bring them back, or are we truly kind of at a point of terminating a resuscitation, right? We know patients aren't going to come back, so why are we prolonging that event? Some of the most exciting things is where can this go in the future? What we can do, anything you can do ultrasound with, potentially we can do in the future. Right, again, we're limited right now by the state, we call it scope of practice. The state, the medical advisory board, lots of people look at it and said, right now you can look at cardiac function for cardiac arrest. In the future, we would be able to use this for trauma exams. They call it a fast exam, right? Slapping on some jelly in there on patients with pulses, right? And we can take a look, is there blood in the heart cavity? Is there blood in the belly? Is there blood in the bladder? And this would actually allow us to get in there and actually see what's going on, right? What is the blood pressure? What is a pulse? Are we getting good blood flow? Do they need fluids? Do they not need fluids? Maybe they need something to improve the function of their heart versus maybe they need something to get their vessels back up. So there's so many diagnostic things we can do with this, and giving that information to the hospital, once we establish that relationship, that proficiency, and being able to say, we have a patient with blood in their belly, you need to get that operating room ready. We're not there yet. I don't even know that we're close. We'll be there someday. So how can we continue to make that better? And here was an opportunity, right? The literature is out there. Here was an opportunity to add this tool to our toolbox. And then, as if anyone's following the budget stuff, we'll actually be adding a second deputy chief this year, 2024, to assist with the training, because we've added all of these great tools. We're adding this ultrasound. We have portable ventilators. We have IV pumps. It is great tools that can take our medics to the next level, ensure their proficiency, get to that naturalization level. They can pull it off the shelf and say, yep, this is what it is. This is what those patients need. When we look at all the things we could be doing, at the end of the day, we say, what is our job, right? And that is to provide the highest quality of care to our residents, to the visitors, to the employees, the employers of our district. But again, incorporating that into those current evidence-based things we know that work, and not delaying on scene times, providing great care, and incorporating this into part of that resuscitation.